Hello, everyone, and welcome back to the Accreditation and Certification PCMH Huddle series. Today, we'll be covering the Patient-Centered Medical Home PCMH Self-Assessment Tool. My name is Natasha Green, and I will be your facilitator for today. With me, I have Allison Bruner, who will be our discussant. She'll be busy monitoring the chat for us during this Huddle series, so please feel free to use that chat function as much as you would like. This Huddle series was put on as part of the Partnership to Advance Tribal Health project, who collaborates with Indian Health Services. Next slide, please. For today's agenda, we'll first complete our welcome and cover our objectives. For this Huddle series, the objectives for today we'll cover the objectives, we'll cover the objectives for this Huddle series, and we'll have specific objectives for today's specific Huddle series today. We'll also cover the PCMH self-assessment tool. We'll reference some documents and additional resources, and then we'll close out the session with an open discussion and open office hour. This open office hour will be held at the end of the session and will last 15 to 20 minutes. And during this open office hour, you can ask any questions related to accreditation, certification, or PCMH that you would like to have answered, either by chat or by coming off of mute. And again, these Huddle series are meant to be a networking opportunity, so we hope to hear from you all today. Next slide, please. Again, welcome to the Accreditation, Certification, and PCMH Model Series. This is session 2 out of the 8 sessions of this Huddle series. And as mentioned before, we will be covering the PCMH self-assessment tool. We hope to see you each Wednesday at 2 p.m. Central Time, 1 p.m. Mountain Time to go over these accreditation and PCMH topics. So why do these Huddle sessions matter? All facilities must be accredited, and these Huddle series are targeted to assist you with that goal. The second bullet point really relates to why it matters for today's session. The Office of Quality Headquarters team sent out a memo a few years back stating that all facilities must obtain Patient-Centered Medical Home, or PCMH, designation by December 2021. So this tool and this Huddle session is meant to help guide your team towards that goal. And finally, it aligns with the IHS goal number 2, which is to promote excellence in quality through innovation of the Indian health system into an optimally performing organization. Next slide, please. We have 3 overarching Huddle series objectives for all 8 sessions. The first one is to learn and apply new techniques and tools to use with accreditation. The second is to improve overall accreditation knowledge, and the last is to improve overall PCMH knowledge. During our previous session, we asked a poll question, which we gathered some good insight as to where everybody feels they are at with accreditation and PCMH knowledge. So thank you to those who were able to attend that session and give us your insight. Next slide, please. During last week's session, we had a lot of great input and discussion. One item that was brought up was a request for a PCMH policy example. After that Huddle session, our team went ahead and found the example that we have shown here. We uploaded it to the quality portal and we sent it out via email. But if you didn't receive the email of the policy example and you wanted it, please put that into chat now, as we can send that out as well. As I mentioned before, we did put it into the quality portal. So we have the link attached to the PowerPoint materials that were sent out earlier today in the reminder. But we'll also place this link into chat so that way you can access the quality portal link as well. We also had a request for knowledge on how to help champions and leadership teams make recommended corrective actions when it comes to accreditation. So our team got together and brainstormed 3 key concepts that we wanted to share with you that we felt would help your teams get there. The first thing that we recommend for champions and leadership when it comes to making recommended corrective actions is to first perform a gap analysis. So this may have already been done when you were given your citation, they noted whatever area of opportunity you have. But what you can do is find best practices or other toolkits that can give you some insight on how the process should work. You'll want to first figure out where you need to be, so that way you can identify where those gaps specifically are, and then your team can come together and discuss what the options could be used for meeting those gaps identified. The second item that we wanted to share was just using a root cause analysis tool to get to the root of the problem. And we know everybody on this call is pretty familiar with those. And they're great tools. They're tools such as the 5 whys tools, the cause and effect diagrams, or fishbone diagrams. And they can really help your team target a specific problem, so that way you can come up with a solution. And finally, the last recommendation is to have the right stakeholders present to come up with the solutions to the problem once you know what that problem is. It's really important that you have the key people there, and sometimes it may need including frontline workers, especially if they're ones working in the process that has a problem. They can come up with valuable feedback to help the team. The best thing that leadership can do from that point is support the intervention that has been decided upon and agreed upon by the team. We hope that that's helpful, and we want to make sure that we show you that if you come with questions or things that you'd like addressed during this Huddle series, that we share those and we follow up on those in a timely basis. So as we work through these Huddle series, if you have additional questions or if you have additional requests related to accreditation or PCMH, please make sure to come off of mute or type that information into chat so we can make sure to address those. Next slide, please. As I mentioned before, we have overarching objectives for the accreditation and certification Huddle series, but we also have a specific objective for today's session. We want our participants to review the Joint Commission and PCMH standards and the self-assessment tool developed by PATH to learn more about PCMH's key standards and to understand how to use the PCMH self-assessment tool to prepare for your PCMH designation survey. By going through this tool, you'll be able to identify what things you are meeting, as I spoke about before with doing a gap analysis, and what things you aren't, so that way you can create action plans to meet those. Next slide, please. Now let's go ahead and have some fun. We do have a word cloud that we would love for you all to participate with. So to do the word cloud, we have either a QR code that you can open up your phone with by opening up the camera and holding it over the QR code to access, or in chat we'll be pasting, Allison will be pasting the Mentimeter link in there for you to use, and you'll be able to respond. And once we give everybody just a few minutes to go in there and respond, we'll go ahead and shift over to our word cloud that is developed. But our one question for you all is, what is one word you would use to describe PCMH? So if we could give everybody just a second to get that link, we'll go ahead and paste that into chat. Thank you, Allison. And then we will go ahead and I'm just going to paste another one in case that other one doesn't work. We'll go ahead and watch the results. And we encourage all PATH and IHS folks to go ahead and participate in that word cloud. Jonathan, have we had some responses yet? Let's go ahead and refresh that. There we go. We've had 12 responses so far. Thank you guys for participating with this. It makes me so happy. This is a new feature that we're trying, but we want to keep everybody engaged and we want to know what you know about PCMH. So I see the biggest ones are quality, patient focused. I also see patient-centeredness, continuity of care, patient a lot, comprehensiveness, coordinated care. Love seeing that. I've seen that a couple of times. Patient focus, excellent. That's great. While we are waiting for others to complete this, let's refresh it one more time, Jonathan. I'd also like you to type your name into the chat box on your name and the facility that you're from, and then your favorite ice cream treat during the summertime. My favorite treat to have during the summertime, and I shared this on another call that I was on yesterday is the cherry dipped vanilla ice cream cones from Dairy Queen. They are my favorite, and it is the hardest thing to try to avoid each and every single day during the summertime. So if you could put your name and the facility that you're from into chat, that would be great. Rebecca, you put frozen hot chocolate. Oh my gosh, my heart. That sounds delicious. Sarah, you put ice cold lemonade. Yum. Marilyn puts homemade vanilla or sorbet. Love it. Oh, I love fresh fruit as well, Ellie. Oh, yum. Great. So if you guys could keep sharing your favorite summer treats, ice cream treats, that would be great. Ooh, I even see a dreamsicle. Thanks, everybody. Now they're floating in, everybody. Rip your floats too, Carrie. Oh, those are my favorite as well. I just love them all. I feel like my treats always change every single day. Okay, Jonathan, let's go ahead and go back to our presentation and to the next slide. Thank you all for filling out that word cloud. We're gonna have to switch the display settings, Jonathan, to see the presenter slides. Oh, still seeing the presenter slides. There we go. That looks better, Jonathan. Okay, so now I want to talk about why it's important for today's huddle session for you all to complete that PCMH self-assessment tool. I spoke a little bit about this before, but after you complete this tool, we hope that you would share the results with your leadership team regularly and meet on a regular basis with your committee to update the progress made regarding your PCMH designation. It's important to meet with smaller groups focused on the individual plans as well, so that way you can ensure action happens. And just remember, as we work through this tool and as you start working on PCMH designation, you'll want to start small. So know that even after completing the tool, start small with your action plans and just continue to move forward. Next slide, please. Just as a heads up for everybody, the IHS Office of Quality has asked PATH to assist with the completion of the PCMH self-assessment tool with all of the CMS certified IHS hospital facilities. So all of the facilities who do not currently have PCMH designation have been or will be asked to complete the self-assessments by July 31st. All the facilities who do already have their PCMH designation, but it's due this year, will ask to have those completed by August 31st. And finally, all the facilities who do currently have PCMH designation, but you're not due to do your redesignation until after 2021, you'll be asked to complete the self-assessment by September 30th. And the reason of this is so that way we can figure out where to target our support, where can we make sure that you have technical assistance available to you so that way you can be most successful with your survey readiness. Next slide, please. Some of you have probably seen this PCMH self-assessment tool before. So we call it an updated tool. We've had it in the previous PATH work and we've updated it with the current standards on the Joint Commission website. You can find this tool, the updated version, either by contacting your PATH QIA or by going to this link here that I pasted into chat now on our PATH website. It's a great resource to help track your team's progress towards accreditation, and it works as an action plan template. And it does reference specific Joint Commission PCMH standards, which is helpful during a survey as well. When your teams are crazy doing Joint Commission survey, it's nice to have something that they can reference. So if Joint Commission has a question, they can look to the right page and say, here's our response. Here's the policy that addresses that specific standard. And even though this is Joint Commission, most of the sites that we work with do Joint Commission, but PCMH is an overarching concept, so completing this tool is still very beneficial for most. Next slide, please. The first section of this tool that I wanted to point out is the dashboard. And this dashboard gives your team and leadership an at-a-glance view of your current PCMH standard. It's a great dashboard to be used during governing body reports and helps you and your teams prioritize action plans. You'll be able to really drill down and see which sections of the Joint Commission patient-centeredness you are really succeeding on and which ones need a little bit more of a focus. This chart is set so that way it automatically updates as you complete the tool, which is also really helpful. Next slide, please. When going to use the tool, you'll complete the self-assessment by going through each tab. Now, I suggest that you bring this tool to your actual PCMH committee or work group that you formed and not complete it on a one-on-one basis, just because you need to have the right stakeholders there to complete the tool. The Joint Commission breaks down PCMH into these 5 concepts: patient-centeredness, comprehensiveness, coordinated care, superb access, and systems for quality and safety. I saw a lot of those on the word cloud, and so I know all of you are very experienced as to what PCMH is. And thankfully, we've broken down this tool to align in that same way. You'll first select the section or the tab that you want to review in the Excel tool, and you'll also ensure that as you complete the review that you have some of these stakeholders that I have listed here. These can include the provider champion, nurse champion, a CAC, IT person, leadership team, and quality. And as I mentioned before, you may be pulling in other stakeholders, or others may be joining or removing your work group or your committee based on what you're reviewing, just to make sure that you have that frontline staff's perspective. I've completed this tool many times with different facilities, and I can't tell you how many times we've said, yes, we're meeting this, but then during another assessment with a different individual joining the committee, we find out, oh, maybe we're not. We say that we're doing this, our policy says that we're supposed to be doing this, but in practice, we're not fully doing this. And so then we have to go back and reassess and figure out what is actually happening so we can meet that standard. And that's why it's important to have those right stakeholders there when completing this tool. Next slide, please. To complete the self-assessment, you'll first start left to right in the number column. The number column states the current Joint Commission standard as it reads on the PCMH self-assessment PDF tool located on the Joint Commission website. The link's provided in the PowerPoint slides, but I'll also have it into chat. Now, if you do notice that some of the standards or EPs are off, it's probably because the Joint Commission manual has been updated, but they have not yet updated their PCMH gap analysis tool. So it's important that you look just a little bit above or below in that same standard area, because usually what happens is the element is just a little different. So it may be EP1 versus EP2. Next slide, please. The name of the column describes the standard and what must be met when reviewing the standards. Your team will decide if your facility meets the standard set. So you'll want to discuss it, how you're meeting it. You'll use the yes or no column to select the appropriate response. And depending on the section, that response may be a yes, no, yes at some sites, and yes at all sites. And just a note, some of the numbers or standards, again, may not line up. So just make sure to double check that. Next slide, please. If you select yes or yes at all sites for your yes or no column, make sure to document your evidence of compliance in the evidence of compliance column. It's important that we have supporting evidence so that your team knows exactly what they're doing to meet that standard. Again, this tool can be a great resource for your team. So I know many have either printed it off in their accreditation binder or have located it on a shared drive so team members can have access to it. So that way they feel comfortable when they're asked questions specifically relating to PCMH. If you select no or yes at some sites for your yes/no column, a plan of action should be completed. You'll want to make sure that you enter the responsible party, the due date, and any additional comments into the tool so that way you can follow up appropriately. And we'll go over that in the next slide. Next slide, please. As I mentioned, these fields highlighted here should be filled out to help your team track progress towards PCMH implementation. And it's essential, so don't skip these steps. Now, when you're completing the self-assessment tool initially, don't feel like you have to come up with a plan of action for everything. This can be done differently depending on your team and how your team wants to approach it. You may want to go standard by standard and complete the tool. And if you answered no or yes at some sites, you may pause and say, okay, we want a plan of action before we continue on. Others may say, we just want to complete the whole tool, identify what things we are meeting and which things we're not, and then come back and start working on the plan of action. So just know that this tool is flexible, and all you need to do specifically right now by those due dates is to complete the yes, no column to ensure that we can figure out where you're currently at on your PCMH journey. Next slide, please. As I mentioned before, our PCMH tool, self-assessment tool, is based on the Joint Commission gap analysis, but your IHS team also has a PCMH tool that's still important for you all to complete. This tool provides accurate data to the Office of Quality, again, so they can provide support. It identifies opportunities for improvement so the Office of Quality and the PATH team can help you move through your improvement efforts. Next slide, please. Just like the Joint Commission PCMH self-assessment tool, the IHS PCMH tool reviews similar concepts. It is broken down into 8 parts. We have engaged leadership, quality improvement. Next slide. Empanelment, continuous and team-based healing relationships. Next slide. Organized evidence-based care, patient-centered interactions. Next slide. Enhanced access and care coordination. Again, all very similar topics to the 5 that Joint Commission has and the ones that AAHC has, that CMS has, all very similar. And we did include the breakdown of the assessment in these PowerPoint slides, so that way you could have access to those to reference at a later time. Next slide, please. When you complete the IHS PCMH-A tool, you'll be given a score. So a little different than the Joint Commission tool. The Joint Commission tool tells you the number of standards and whether or not you're meeting those standards, where the PCMH-A tool gives you a score on how you're rating when it comes to PCMH knowledge or concepts. The highest score that you can get on the PCMH-A tool per concept is a 12. If you have between a 10 and a 12 on any of these core concepts, you're considered to be fully developed regarding PCMH. If it's below a 10, that suggests that you have opportunities for improvement in those areas. Next slide, please. Again, if you're looking for some good resources, make sure you check out the IHS Quality Portal for many resources related to accreditation or PCMH. It's really nice because you can search different tags like PCMH or accreditation, and it'll list everything that you're looking for there. And as I mentioned, as we create things or as other individuals from IHS create things, they upload those to the quality portal to share. You can also reach out to your PATH QIA for support or questions. And then like now, you can reach out to your IHS peers and network like we're doing during this Huddle series session. You can also reach out to other accredited facilities outside of IHS, or as another great resource, Joint Commission resources for any assistance. Next slide, please. Now we're going to go ahead and launch our next poll. And for this one, we are asking, did this session help you understand how to use the PCMH self-assessment tool to prepare for your PCMH designation survey? So if you could just take a moment to complete that. We want to again make sure that anything that we're covering regarding PCMH is helpful to you all, so that way you know your next steps for preparing for PCMH accreditation. And again, now's the time to start entering any information into chat, so please feel free to do so now as well. It looks like this was helpful for most everybody. We'll go ahead and share those results. Okay, so let's go ahead and move on to the next slide. We've hit our open discussion point. So again, this is that open office hours section where we want to make sure that if you have questions regarding any specific standards, anything accreditation, PCMH, that we offer that time for you to ask those questions. We also can share best practices. If you're doing something and you just want to highlight what you're doing, that is an opportunity for you to do that now as well. And Allison, thank you for putting that into chat. Appreciate it. Anybody from PATH have anything that they're running into as they are completing the PCMH tool or working with their teams regarding accreditation that they'd like to share?
Natasha, this is Allison. I'm just wondering if anyone else in the service units are using the AMP JCR tool for tracking for Joint Commission readiness.
Great question. Does anybody know what that AMP software is from Joint Commission Resources that Allison's referring to? Allison, would you mind talking about that software just a little bit for those on the call?
Yeah, so AMP or Joint Commission Resources or JCR is how the service units in Montana are tracking their Joint Commission readiness. So meaning how ready they would be if Joint Commission were to come and survey them and how they would do with that survey. It allows you to score yourself on the standards and EPs and track that progress as well. It also allows for a mock survey to be done. And so I'm asking this in regards to the PCMH tool because we're able to pull a report from AMP that shows the PCMH standards and EPs and then place it into that PCMH tracking tool that PATH has created to automate that tracking spreadsheet.
Thanks, Allison, for that background. I know Crystal's on the line. I just saw her, so I'm sorry for picking on you, Crystal, and I hope you're by your phone. Just as a reminder, you may have to press *6 if you're joining by phone to unmute, just as a warning to you. But Crystal, I know that with the Great Plains area, when they contracted with JCR, that AMP software was purchased, but I don't know if any of the facilities are using it or if you're using it.
Hello, Natasha.
Hello, I can hear you.
Okay. So I don't believe that I don't even know if we have access to AMP because I had checked it out and I was like, hey, maybe this would be kind of good, but as far as I know, we don't have any of that. We didn't get anything like that from Great Plains.
Yeah, I was going to say it's been quite a while since I've seen it, so I didn't think that currently we did, but I wasn't sure. So thanks, Crystal. I appreciate that.
No problem.
And I do see someone calling from Standing Rock. I don't know if you use AMP software or not. If you could come off of mute and let us know. I can't tell exactly. Oh, there you go. You're off of mute. Go ahead.
Hello,
Hello.
can you hear me, Natasha?
I can. Hi, Joelle.
Hi, this is Joelle. No, not that I'm aware of, that we do not use AMP software.
Great. And you've been a part of, and I know Crystal too, you guys have been a part of completing this PCMH tool, and it's been helpful for the staff to kind of go through as like a coaching almost, I feel like, when you're completing the tool, right?
Yeah, that is helpful for the nursing staff that work down in the pods.
Mm-hmm.
Yes, very, very helpful.
Thanks you guys for letting me confirm. I didn't think that it was being used, at least in North Dakota, but I wasn't sure. Anybody else from the PATH team know or have any insight? Nancy, I think I saw you on the call. One of the things that came up during some of our calls recently was health literacy, and I can't remember. I see Jana typing in too. We don't use AMP. Thanks, Jana. I remember that in one of the sites they had difficulties with health literacy, and I can't remember if during our sessions if we spoke about that previously or not. But did you want to give a little background on any of that, or would you be willing to?
Sure. Can you hear me okay?
Yeah, thanks, Nancy.
Yeah. So one of our facilities in South Dakota was actually using the Realm tool. And I'm sorry, I'm not prepared. I can't even remember what Realm stands for, but it's REALM. And they were basically what you do with that Realm is you give a list of words to your patients to be able to read back to you to basically assess their health literacy. And their patients were finding that they didn't like it. And so they decided to go back to the drawing board and just settled with an overall approach on health literacy, and that they were going to utilize the teach back as their assessment to health literacy. And then they developed some dot phrases to use within the EHR to help with the provider's documentation of, yes, you know, the patient understood all of the instructions that I gave them today. And then the next dot phrase was, yes, they understood, but that needed to be reinforced. And then the last dot phrase was that, you know, they were not grasping or understanding the instructions that were given today, and that we needed to have a support person or a family member called in or given the instructions to help the patient. So I'm not sure if I explained that appropriately, but
That's perfect, Nancy. And the reason I wanted to bring it up too, or ask you to talk about it, is I didn't know if anybody else has been experiencing that. I know we've heard that a couple of times where some of these assessment tools are using certain language, like even with our age-friendly program, like mentation has been not appropriate for the patient populations. And so I was just wondering if anybody else was encountering that at all as they're working towards their PCMH designation. Does anybody have any other health literacy tools that they use that have been successful?
Natasha, this is Nancy, and just to kind of fill a little bit of the quiet void sometimes that we have. I thought it was really nice how this team recognized this rather quickly and did a very small test of change to realize that, hey, you know, our patients are not liking this. We have to go with something else. And so they reconvened as a group. They meet on a weekly basis to address anything PCMH related and have their gap analysis tool pulled up every single week when we meet. And so that's when they had this nice big discussion on what are we going to do with health literacy and how are we going to handle things going forward. There was one other tool, Natasha, and maybe you can talk about this one because you actually shared it with me. One of the questions they had was how do we assess a website, or, you know, we might refer a patient to a website or, you know, a certain URL. Can you talk about the tool that you shared with me that basically assesses the reading level of a URL of a website?
Yes, I can't remember exactly just because I don't have it on hand right now, but there is a website that you can use that will assess the health literacy of a website or of content to help ensure that the materials you're providing to your patients is at that right health literacy level. So that way, when Joint Commission comes in, you can say, yes, we ensure that all of our items, our educational items, are at a 6th grade or lower reading level. And so that way we can ensure that's appropriate for all patients. And then, of course, if there are patients who need assistance, then we ensure that there's someone who can provide or have that understanding as using the teach back method in documenting. But it's a great resource to. Another thing that I found is that a lot of providers are just Googling education sometimes. And so we want to try to get them to a standard education platform. So make sure to check in with your providers to say, hey, are you using the I or the E button in the RPMS system to access the patient education materials that as an area or a facility you have to actually purchase. So that way you can ensure that the materials and the education you're providing to your patient is at that right health literacy level. And when you use the RPMS system in that way, any education you access from those resources will go into the after visit summary for your patient, which is also a nice feature as well. But if you're interested in knowing what that link is, just type into chat yes, and we'll make sure to send that link out to you so you can have that. Perfect, April, we'll make sure to get you that. The next thing, I know we still have some open discussion things, but we're always wanting to know what would be most helpful for everybody to talk about. And in one of our sessions is a chosen topic of everybody to decide on. And so if you have something that you'd like us to cover, please go ahead and put that into chat for us so we can make sure that we're addressing everybody's needs. I'm gonna pick on some people too that I know as well. I know, Jana, you were typing into chat, and I know you guys are still a little new with your PCMH journey, but is there a topic that was or is most difficult or challenging for you guys to meet as you're working through? If you're willing to come off of mute, Jana. She may have stepped away. Oh, there we go. Hi.
Goodness, I had to take a call for a patient complaint. Oh. So I missed what you said, but I'm back now.
I was going to ask, you know, I know you guys are newer to starting on your PCMH, you know, at least the self-assessment, but your PCMH journey. Has there been anything that's really like stood out as a challenging concept if you were to look at PCMH as a whole?
I think you've already talked about it, and that's the health literacy.
Yeah.
That's been our biggest challenge.
Yeah, it's a really difficult one. I know Tasha, you're on the line too, and Standing Rock did something really great with bringing their elders in to identify some opportunities for signage and things like that. I don't know, Tasha, if you want to speak to a little bit of what they did there.
Sure. Can you hear me okay?
Yeah.
Yeah, so one of the things, and I think this is important when we talk about health literacy, is that we do have to go beyond just reading level, right? So especially when you talk about in tribal communities, there's cultural differences, and so making sure, and down to the language. So making sure that you're putting information in a relevant form. And so one of the things that we worked on with Standing Rock, and unfortunately it just didn't come to fruition yet, but definitely an area they want to expand on, is translating things into the language, the Lakota language and Dakota language, to be more specific, because the feedback that we received from some of the elders in the community is that when you translate it into their own language, it just there's a different meaning, and it's so much more complex. It's the way they put it was that English is very one-dimensional, and some of our traditional native languages have much more depth to them. And so that was one of the things that they talked about, and as simple as greeting, having the front desk people greet patients in the language, those are simple suggestions they had. And then also signage, like they were talking about, how do we come up with new words for x-ray, what is that, how do we describe that in our language, or lab, things like that. And so they had some really good ideas for incorporating language into signage, and of course also into the educational material. I know one good example is in Pine Ridge, and this was quite a few years ago, but they translated an advanced care planning brochure into the Lakota language so that they could explain, that's a tough conversation to have with people, but translating it to the Lakota language is a little bit more comfortable for people. They understand it a little bit differently. And so those are just a few examples of how going beyond just reading level is really helpful.
Thank you, Tasha. I appreciate that. Well, this has been a really great discussion. We'll go ahead and advance to the next slide. But if you still have questions, comments, please plop those into chat. Okay, excellent. I wanted to make sure that we covered everything. As I mentioned early on, we do have these every Wednesday for a while. There are 8 sessions, and we're on session 2. Next week will be session 3. So we hope that you can join us again on June 23rd at 2 p.m. for our huddle, which will be discussing preparing for survey documentation. I believe Carmen, who is with us today, will be covering that session. So I'm excited to hear about that. I got a little preview of that, and I'm just overly excited for it as I usually get. But all of these sessions, again, are prepared with you all in mind. So any feedback that you can provide is very, very valuable and very meaningful. So we appreciate you joining these calls and making sure that what we can help provide to you is meaningful. So again, if you have any questions, if you're running into any struggles related to accreditation, PCMH designation, please join these Huddle series. Encourage others to join as well. But also email your quality improvement advisor through PATH. They can help guide you to where you need to go. All right. Thanks, everybody. I hope you all have a wonderful day and a wonderful week until Wednesday. Here's our additional resources. I thought they were somewhere. We do have additional resources attached to those PowerPoint slides as well that were sent out. But again, the CAWFlex program is a great support resource. And then the Joint Commission resources link is another great resource. If you have access to those resources, I strongly encourage you to use them, just like the AMP software. It's another thing that if you have it, it's wonderful to use. Next slide, please. I don't know if there is another one or if that's the end, but I just want to make sure. It must be the end. Have a great day, everybody.